Hey everyone. When you are enrolled in the dental hygiene program, you are going to learn how to take a good medical history and provide yourself with the opportunity to treat your patient in a safe way. Part of taking a good medical history is having a really nice understanding about pharmacology and the drugs associated with a lot of the chronic diseases that our patients have. In this episode, we're going to talk specifically about non-opioid analgesics, and hopefully this will break it down in a way that makes sense to you. But I also wanted to let you know that I'm going to attach it to some of the clinical aspects of patients taking these medications and some of the things that you have to consider in the clinical setting in order to get the right information out of your patient when you are performing a medical history with them or talking about recent changes or medications that they may be taking. One of the challenges in hygiene school is learning all about the different drugs and what they're used for and what the precautions are and what the side effects are and what the contraindications are. So hopefully by doing little segments and bits by bits, right? Little tiny bits of information about all the different drugs will help you learn the information in a way that you can understand. So tune in. This is non-opioid analgesics. Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. Hey, are you in dental hygiene school or just got your acceptance letter and just started dental hygiene school and you're worried about how you're going to fit it all in, what the evaluations are like, what the key strategies you need to set up in order to be successful? You don't want to have worked all this time to get accepted into dental hygiene school only to make some pretty major errors in your first and second semester. I've put together a course that will really help you set yourself straight right out of the gate and get yourself started on the right foot in dental hygiene school. Whether or not you're just entering school or you've done your prerequisites and you're just well on your way halfway through, this course is designed to help get you straight and keep you straight so that you can become a dental hygienist. Click the link in the show notes and check it out. I think a great place to start is looking at pharmacology and direct patient care. We really need to be able to connect the dots of information during our assessment. So you start with the drug name. Document the name of the drugs that your patient's taking. Maybe they're taking a whole bunch of drugs, and some of them might be generic, some of them you might not be familiar with, some of them might be over the counter, some of them might be vitamins. Okay, so this is where things get a little complicated with the medical history. Your patient will make assumptions as to what medications you want them to tell you that they're taking. So it's really important for you to say all medications, whether they're over the counter, whether they're herb supplements, vitamins, whatever they're taking, you want to know. So you start with those drug names and then you want to determine the classification. Determine the class that the drug falls into, depending on some specific factors. And there's lots of ways that you can find this out. You also want to understand the mechanism of action. What is the biochemical interaction where the drug produces a specific effect? And then what are the dosage and routes of entry? Example, are they taking a tablet or a capsule, or are they doing an ointment or a gel? And this is important for you to know. You also want to look up the side effects of each of these drugs, and this is defined as a secondary effect from a medication, and it's usually an undesirable one. And also you want to know the adverse reactions. What are the contraindications or the precautions to treatment or other drugs? Maybe you plan on using local anesthesia today. So the contraindications are a specific situation where the drug should not be used or used with caution in order to keep the patient safe from any harm. This creates risk for the patient, so it's important for you to know what those contraindications are before you do any treatment. What are the dental considerations for your patient? These are the considerations that you should be taking when you are treating your patient due to these specific medications. Maybe they experience orthostatic hypotension, so you want to be careful with the movement in the chair and how quickly you bring the patient back up to a vertical position. Now, side effects may increase the risk during treatment or increase the potential for a medical emergency. So, this is what we are trying to avoid. It's also important for you to think about patient education needs related to the medications that they are taking. Once you know the side effects of the medications and you know that that may increase your patient's risk of things like periodontal disease or increase their caries risk, it's important for you to develop a plan in your mind of ways that you can help the patient reduce that risk or make adjustments to the at-home regimen so that they can minimize that risk as a result of taking that medication. Sometimes our patients just don't know the connection points between things like dry mouth and caries risk. So it's important for us to help them understand that and provide supportive efforts to help them manage those risks. Now, in today's episode, we're going to be talking about analgesics, and those are prescribed to relieve acute pain. And they're also prescribed post-operative to help with mild pain or potential pain that may be experienced after a procedure. These are the pain relievers that don't produce unconsciousness. Now we have non-narcotic analgesics and narcotic analgesics. And in today's episode, we're talking about the non-narcotic analgesics. And these are prescribed for mild to moderate pain. An example of a non-narcotic analgesic would be something like aspirin, acetaminophen, or an NSAID, also known as ibuprofen, and Advil. That would be the trade name. Starting with aspirin, aspirin blocks the formation of those prostaglandins. The primary use for aspirin is that it's antipyretic, analgesic, anti-inflammatory, and anti-clotting, right? So this disables the platelets from sticking together. And so we do have to use caution when we're treating patients who are taking a routine dose of aspirin. The pharmacodynamics of aspirin is that it's absorbed in the stomach, and the peak effect is in about 30 minutes because of the stomach and the small intestine absorption. The adverse reactions associated with aspirin is hemorrhage and gastric upset. Now, aspirin can be combined with other drugs for use. It also can create nausea and vomiting, bleeding, due to those platelets not sticking together. It's important for you to know some of the adverse reactions related to your patient taking aspirin and how you will modify your treatment. And then we have acetaminophen, also known as Tylenol. And the primary use or therapeutic effect of Tylenol would be analgesic and antipyretic, very similar to aspirin. The difference is that there's no anti-inflammatory effect. There's little or no gastric bleeding as a side effect of Tylenol, and there's no impact on the clotting mechanism. So there's no antiplatelet effect with Tylenol. The benefit of Tylenol is that very few drugs interact with Tylenol, and sometimes with more significant pain, Tylenol can be combined with codeine. It is contraindicated for patients with a liver disorder or people that have problems with alcohol abuse. Now, NSAID drugs, non-steroidal anti-inflammatory drugs, reduce inflammation without the use of steroids, and these are contraindicated with patients who are allergic to aspirin. The action of an NSAID drug, it's used as a pain reliever for things like fever, cramping, and arthritis. It's metabolized in the liver. It's used as a pain reliever, analgesic. It's used as antipyretic, fever reducer, anti-inflammatory. It's used also for gout. It decreases the inflammation without any change in the uric acid in the joints. There are adverse reactions to the use of NSAIDs as well, and it can impact the central nervous system and kidneys and blood clotting. NSAIDs are very popular for use in dentistry, especially when a patient has had treatment. We typically provide them with instructions to take an NSAID following treatment if it's not contraindicated based on their medical history. If our patients are taking a blood thinner like warfarin or an antihypertensive or lithium, a proton pump inhibitor, something like that, there are certain times when you would not prescribe an NSAID following treatment. Ibuprofen is considered the best NSAID to use, but we also have naproxen and aspirin as alternative choices. One thing about naproxen that I'll just share, it's similar to ibuprofen, but one thing that's important to know about naproxen is that if it's in the system, it won't allow lithium to be removed, which could allow for dangerous levels. So you want to make sure that the medical history is clear for that kind of recommendation. Patients with kidney disease can cause failure or increased infection risk if you prescribe an NSAID. Patients who are sensitive to aspirin, there can be a sensitivity risk, and pregnant patients in large doses may slow labor or increase the time for delivery. A lot of our patients take these medications to self-medicate for discomfort and pain, and there are lots of commercials that advertise the use of these drugs. So it's important to find out how much, how often, and if your patient takes any of these medications before you prescribe any additional recommendations. One of the things I have found most challenging with patients is that they don't always disclose every medication that they're taking. And sometimes it might be through the process of the appointment that you discover that they are taking some of these medications. So it's important to keep the conversation going and further question findings because the patients do not always connect the dots on what is considered a drug. I believe some of this has to do with the fact that they can purchase some of these medications themselves over the counter. So when we ask them if they're taking any medications, oftentimes our patients think about things that are prescribed to them, and they don't factor in things like aspirin as part of that medication question. So you want to use caution when you're moving forward in the medical history and further questioning the findings to be sure that you have a really accurate documentation of every medication that your patient is taking. I just have to say, for anyone who needs to hear this, that I believe in you. I believe in your abilities. I believe that you can do really tough things, and dental hygiene school is really challenging. And I believe that you just need to keep going. We're going to have good days. We're going to have hard days in dental hygiene school, and you just got to keep moving forward. I hope if you needed to hear this, then you're listening. I'll talk to you soon. Are you looking for study sheets? I've created study sheets that cover the content of this episode. If you're interested or that's something that's going to help you on your learning journey, you can click the link listed right in the description of these show notes. Happy studying! I would invite you to send me any questions that you need answered. Questions come up when you listen to this podcast. I have a link in the show notes, and I'd be happy to answer any questions that you have. Also, I would appreciate a review if you have time to leave one. Thank you so much.